Did you know that Viagra was not originally created to treat erectile dysfunction? Imagine a drug capable of changing the lives of millions of people. But that was actually developed for a completely different purpose. An accidental discovery, an unforeseen side effect, and a story full of incredible curiosities. Behind the famous blue pill lies a world that few know. What is really behind this invention that has taken the world by storm? What you will discover might surprise you and forever change the way you view science and its strange coincidences. Its story almost happened by chance, from a scientific experiment that would have forever changed men's sexual health. Before we begin, subscribe to my channel. Do it for your well-being, your energy, and your vitality. I would really love to know which city you are watching from. Write it in the comments, and I will personally greet you. Now, let's dive into the video. In the 1980s, while researchers were testing a drug intended for the heart, they noticed an entirely unexpected side effect in the men involved in the study. And it was from there that a revolution began. This story is a perfect example of how scientific curiosity and attention to detail can turn a failed drug into one of the most important discoveries in modern medicine. Erectile dysfunction, that is, the inability to maintain an erection sufficient for sexual intercourse, is much more common than you might think. It affects about half of men around age 50, and the percentage increases with age: 60% at 60 years, 70% at 70 years, and so on. It is a problem that can significantly impact self-esteem, leading to anxiety, frustration, and relationship difficulties. Until the 1970s, it was mainly considered a psychological disorder, and the only solutions were psychological therapy, or rather invasive interventions, such as implants or vacuum devices. Then, thanks to that laboratory accident, everything changed. In the 1980s, some researchers discovered that injecting certain substances directly into the tissues of the penis could relax the smooth muscle and induce an erection. This led to the development of the first injectable and intraurethral drugs for erectile dysfunction. However, the real turning point came in the early 1990s when the fundamental role of nitric oxide was discovered. This small molecule is the chemical signal that triggers the erection mechanism. Without nitric oxide, no erection. The discovery was so important that the journal Science named it the molecule of the year in 1992. Despite advances at that time, there was still no truly effective oral drug. Alternative solutions were tried, such as yohimbine or pentoxifylline, but the results were poor and accompanied by unwanted side effects. Then, in the mid-1980s, researchers began studying a new molecule called sildenafil, initially designed to treat angina, which is chest pain related to heart problems. From there, one of the greatest revolutions in modern medicine was born. During the initial clinical trials, the researchers noticed a truly surprising side effect. Sildenafil was causing spontaneous erections in the participants. At that point, they realized they had something special on their hands. Some volunteers even started asking for more doses, inventing excuses like, "I lost it," or "it fell into the toilet." And many of them did not return the remaining pills when the tests ended. The interest was so strong that the scientists deepened their research and discovered that sildenafil works by selectively inhibiting an enzyme called phosphodiesterase 5, which is highly present in the corpora cavernosa of the penis. Essentially, it relaxes the smooth muscle and increases blood flow, enabling an erection. In subsequent clinical studies involving more than 4,500 men with various types of erectile dysfunction, the results were clear. 69% of treated patients showed improvements, compared to just 22% in the placebo group. Thus, in 1998, official approval was granted. Sildenafil, renamed Viagra, became the first oral drug for erectile dysfunction. It was a true revolution. Finally, a non-invasive solution existed, and above all, erectile dysfunction emerged from the shadows, becoming a topic that could be openly discussed, also thanks to advertising campaigns. In the following years, other similar molecules, such as tadalafil and vardenafil, were introduced, further expanding treatment options. As of today, there are more than 136 clinical studies on these drugs, and over 23,000 patients treated with sildenafil. A story that began almost by chance, which has changed the lives of millions of people around the world. Personally, as a urologist, I am truly grateful for these medications. Seeing men who struggle with erections regain their lives, their intimacy, and their confidence is a huge satisfaction. When these therapies work, their confidence and well-being greatly benefit. And perhaps, while you read these words, you see yourself in this experience. Know that you are not alone. What you are going through is something that affects many men more than you imagine. Turning to a professional does not mean weakness, but courage and self-care. You deserve to live your intimacy with serenity and without fear. The first step is to talk about it, and from there, everything can really change. If you're also experiencing erectile dysfunction issues, talk to your doctor. There are safe and effective options. Let me know in the comments what you think about this topic. I'll be happy to respond. Thanks for watching this video. As always, take care of yourself because your health really matters.